Eli was adopted as a healthy child, but there can always be issues that arise, and it was just really nice to come somewhere where they were knowledgeable of adoption and the issues that come with older child adoption. They took so much time with him. They were very understanding. You could tell they knew the specific issues that come with international adoption versus if we just walked into a family practitioner.
The Comer Children's Hospital at the University of Chicago's mission is to provide the highest level of medical care to children made vulnerable by poverty or chronic medical conditions. The University of Chicago's Adoption Center extends that mission by providing comprehensive and similar services to children who are internationally adopted.
One of the challenges with adoption is that you're dealing not only with complex medical issues, but this is a real complex family issue. That you've got a situation where you've got children coming from other nations, each of them with their own background. There's a way of life that they are leaving behind. So our first goal, and I think the most important challenge that we face, is helping children and their families transition from bringing a stranger in their lives into becoming a family member. Now, underlying that, you can't have a good emotional and family transition until there's good health.
Every area of their need was attended to here, from physical head to toe, internal kinds of testing, psychological. What I loved about here was that they said, that's not enough. You know, we know it's good, but we also want to do this battery of testing, and we want to talk to them. And Dr. Gray was awesome. He just was so patient and so kind and so concerned about building the relationships, not only with my husband and I, but with Natty and Bethlehem. I was so comforted by answers of holistic understanding.
We're very purposeful in the supports needed for children made vulnerable by poverty, by lack of healthcare access, or by chronic medical conditions. And for children who are adopted, that's no different. These kids come, however, with perhaps additional or extra needs because of infectious disease risks or periods of significant malnourishment or long-term orphanage exposure. So we've built a care support system to really focus on the infectious disease issues, the medical issues of malnourishment, and then the behavior and developmental aspects of chronic orphanage care.
There was a big learning curve at first, just to how we actually go about the process. We had talked to different people there, and we just got complete misinformation.
Completely misinformed. Yeah. And then when she she was sick and we didn't know what was wrong with her. When we had her tested, we found out that she was positive. Yeah. Then there was this whole other thing of nobody before us had ever adopted an HIV-positive child out of India. So there was absolutely no framework for us to follow. We had found out about the clinic and Linda and Ken. We set up an appointment with her to talk about what was going on with us and how she was. And Linda and the team here, they were completely available to us.
We were really worried, so it was good to be able to talk to people who actually knew the correct information.
And that you felt confident were experts.
Our adoption program puts us in a unique position to care for growing families. Not only are we able to care and help families that are adopting healthy children, but there are many families with room in their lives to adopt special needs kids. This can be kids from a variety of backgrounds with a variety of health issues, things like hearing loss, kids with cerebral palsy, kids with HIV or perhaps with chronic hepatitis, children with heart defects, hearing problems, cleft palates. But because we are a leading medical center, we are in an excellent position to not only help these families with the adoption process, but we are part of your team as your family grows to provide good care for these kids so that they have the best shot at a good life in a new family.
a position with Project Hopeful. We educate, encourage, and enable adopting children with HIV. Dr. Gray and Linda were doing the educational seminars that we were holding to help other people learn about HIV and its care and management, and it just became a natural progression to pursue an adoption, and we came home with Dasha, and her virus is managed very well here. We were even at a Christmas party that Linda was at, and Dasha had a really wicked cough, and Linda tried to listen to her chest even in the middle of this party, and she was concerned, and she called in a prescription for her. So even not during, office hours, the clinic is here ready to help and very helpful.
The challenges involved in adopting a child are many and varied. It can be physical challenges, developmental challenges, learning challenges, challenges within your community or family. And I think the University of Chicago Adoption Center is uniquely able to meet these challenges in the fact that we can provide the initial care, and yet we're around to provide follow-up care as problems or issues arise. We have expertise medically in all subspecialties, but we also have expertise in development and learning, and we have the network of parents who've walked the walk or gone down the path before.
One day, we were particularly worried, so we called Linda, and she said, well, call us back in like 20 minutes.
She had a horrible cough.
Yeah, really terrible cough. We called back, and Linda put us on speakerphone, and she's just said, hold Sachi up to the phone while she's coughing. She basically got all these people in one room, and we're willing to listen to her over the phone.
As families continue on their journey, when problems arise, or issues arise, or questions arise, we're very accessible. Families can call us or email us, and we remember them, and we get back to them, and whatever the issue is, whether it requires a referral or a supportive visit or whatever it requires, we're able to handle it. And this is our passion. We love it. It's a great privilege.